It is now a great pleasure for me to introduce our plenary speaker, Dr. Victor Dzau, who is president of the National Academy of Medicine. Dr. Dzau spent much of his career at Duke University, where he led pioneering research in cardiovascular medicine. We're delighted to have Dr. Dzau join us for today's program. Dr. Dzau.
Thank you very much, Eric. And let me begin by thanking Brandon, Garen, and Sherry for inviting me to this very special event. You know, I'm a physician, a scientist, but I spent years as administrator, as the CEO of Duke University Health System, and the last 6 years I've been leading the National Academy. We care a lot about what happens to the nation, and of course, in this particular area, we care about mental health. I think all of us are here today because we all care about mental illness. And of course, many of us have personal experiences with this disorder, whether it affects ourselves, a friend, or a loved one. My wife's cousins and their children are afflicted with depression, bipolar, and other illnesses. I've seen the struggle. It's difficult, but having the right resources and support, they're doing well. But I think my experience is not uncommon. In fact, we all know that 1 in 4 people suffer in the world suffer from a mental and neurological disorder. So if you look around this gathering, I know it's difficult to do the Zoom piece, but it's clear that everyone will know someone with this condition. We also know how difficult it is to deal with mental illnesses. People don't talk much about this as we do with physical conditions such as heart disease. I'm a cardiologist, or cancer, or kidney disease, because we all know there continues to be stigma associated with mental illnesses, and also the fact that these conditions are difficult to treat. But in addition to my family experience, I have become very passionate about improving mental health. This is based on my years as the CEO of Duke University Health System, watching how we struggle as a system to deal with this issue, and nationally as a country. And of course, most recently, my relationship with Brandon, Garen, and Sherry have really inspired me. They are working so hard. They have showed us the way, and I'm so glad that I'm working with them now, closely together, certainly supporting one mind, but also on new initiative, which I presume I'll have a chance to talk about later, which is a Healthy Brain Global Initiative. I think it is time for the world to acknowledge the prevalence of mental illnesses. It's time that we get involved to change the current state of mental health care and prevention. That is why this event is so important. Important to get the support that is so much needed for work in brain health. And I'm so optimistic of the future because I know together we can transform this field. But let's first look at the problem. It is a big problem. Mental illness is the #1 cause of adult disability globally, the major disease burden that causes disability. 450 million people and more worldwide live with this. I mentioned 1 in 4 people are affected by mental neurological disorder. 90% of nearly 1 million people worldwide who die by suicide each year have a psychiatric condition. And financially, the global economic burden is $3 trillion annually. It's estimated about 12 billion working days are lost every year due to mental illness. But it's important to point out that mental health is linked to physical health, chronic disease. Majority of people with mental health also have physical illness such as diabetes, hypertension, heart disease, etc. We know that mental health affects people of all ages because, when you're older, you think about Alzheimer's, neurodegenerative disease, but it really starts very early from young children to adolescents and young adults. And we know there's no one single cause of mental illness. There's a number of causes and factors that contribute to the problem. Biologic factors, well, certainly it's been associated with chemical imbalances and evidence for genetic factors. But I believe that experience, environment is really important. Early adverse life experience, particularly in your childhood, is trauma, history of abuse. And, these experiences have great impact, particularly when you're growing and your brain is still developing. Trauma, physical, emotional, harmful, and threatening, have long-lasting adverse effects. Social factors, the tremendous pressure people live under, the isolation and bullying, and of course the use of alcohol or drugs. And it's been shown that frequent marijuana use during adolescence is associated with increase of psychosis in adulthood, particularly if those individuals carry a genetic variant that predispose them to this. So let's talk a little bit about the youth, the adolescent, the young adults. We know that 70% of all mental health conditions arise by this age, because this is a critical time of both biologic and social change. The brains undergo maturation, the synapses undergo pruning in the prefrontal cortex, there's improved efficiency of information processing, neural connections between prefrontal cortex and other regions of the brain are strengthened. Now, you're going to hear a lot of great signs today, and you already know about them. So this biological process is important. It's a time when the environment is also changing for these adolescents and young adults. Transition to independence, peer influence, finishing school, forming lifelong habits. Well, this is a susceptible age. Surveys in United Kingdom found 38% of young people report that social media have a negative impact on how they feel about themselves, and exacerbated for girls, with 46% of girls stating that has a negative impact on their self-esteem. We know that children and young people are currently experiencing a mental health problem, are more than 3 times likely to have been bullied online. So these are really important issues. As we see the increasing incidence of mental health globally, we know this is related to better detection, more awareness, reduction of stigma, but also increasing social factors. Now, take, for example, you can hear about this, what we face with right now with COVID-19 and other environmental disasters. It certainly has affected people's mental health and well-being. And it's created new barriers for people suffering from mental illness and substance use disorder. Many experts call this a second wave of mental illness, a second pandemic, if you will. During the COVID-19, we know that early studies show already 30% of US adults report stress, anxiety, sadness that was difficult to cope with by themselves. But if you look at time, it's getting worse. In March, 32%. Now in July's data says even 53% feel they've been negatively impacted from a mental well-being. And we know, of course, social distancing, lockdown, creates isolation, and that's a factor. And for the elderly in particular, when already 43% of older adults feel isolated, this problem is getting worse. But COVID is not the only example. Katrina, other environmental disasters. During Hurricane Katrina, we saw high rates of acute stress, PTSD, depression, suicide, increase in interpersonal violence, domestic abuse, risky behavior, alcohol, and other substance abuse. And of course, the damage due to environmental disasters can limit the resources available for mental health care. So what are we doing about this? Well, today, we still have a lot of work to do. Despite the high burden of mental health, there are many discussions on priorities. Progress has been slow, and that's why your help is so important, and also the great work that you hear some of the other speakers are doing is important. We know we have a problem with access, but 1/3 to 1/2 or more people with serious mental health disease do not receive treatment. We know stigma is a problem, and that can deter patients from seeking treatment. It also influences the way the providers care for patients. We know our American healthcare system is highly fragmented, too specialized, not integrated. So someone with mental illness has to navigate a complex maze of different providers to get help. We also know that social factors are important, so-called social determinants of health. And yet, a medical social service are separate and not integrated. We know we don't have enough healthcare professionals who can attack this problem. Nearly 90 million Americans live in areas with a shortage of mental health professionals, and 2/3 of primary care physicians report difficulty referring patients for mental health care. So we need to do a lot more training, not only training specialists, but primary care physicians, healthcare providers. And so this way, they will be more sensitive and be more prepared to assist people with mental health problems. At the end of the day, I think the real issue is priorities and resources. If you look at globally, this is a big problem. The investment in mental health is pitiful. If you look at global data, 33% of countries allocate less than 1% of the health budget to mental health. And even when they invest it, they put it into mental health hospitals, standalone institutions, separate from community. We do know that where we have to go is patient-centered, community-oriented care, integrated into routine care and social care platforms. And of course, health systems, being a previous CEO at Duke, don't always prioritize this. I'm afraid to say I tried really hard, but we need to change the way we look at things. And of course, there's inadequate research investment. But there has been hope and optimism because this problem is becoming recognized more and more and more in our country and everywhere else. In 2013, the WHO's Mental Health Action Plan was adopted with the highest level of political commitment from all 194 ministers of health in the World Health Assembly. So they have clear objectives, actions, targets for 8 years. In 2015, the Sustainable Development Goals recognized promotion of mental health, prevention of mental and substance use disorder. 2016, the World Bank endorsed mental health as a global development priority. And 2018, Lancet Commission says we need a reframing of mental health. So my point to you is, and you know this, we all need to change the way we look at mental health, the way we deliver care, and the way in which we use science and technology and new models of care to address this. I'm actually optimistic because I know there's a lot of excellent science going on to understand brain health and mental illness. I think we need to include a lot more social behavioral sciences. We know there's an effort to improve the care of people with mental illness. We do know a lot more needs to be done. Transform the whole field. Care must address the daily needs, not when they need to seek your help. A patient with illness. We have to work on prevention. We have to effectively utilize innovation, science, and technology. As we can talk a little bit more about this. And of course, we need a major leapfrog in science to understand the complexity of the brain biology and apply this new development treatments and therapies to improve the health of everyone, particularly in the area of mental health. Thank you for listening to my initial comments. I'm happy to turn back to Eric, and presumably he's going to ask me some tough questions.
Thank you very much, Victor. That was spectacular. I want to remind the audience to please ask questions in the Q&A function. I'll get the questioning rolling. Dr. Dzau, you mentioned the challenges that we have with access and barriers to mental health care. And I was wondering what you would suggest as president of the National Academy of Medicine of specific steps that we can take in this country to improve access to mental health care. You touched on it a bit, but I was hoping you could expand.
Sure. Well, at our National Academy, we convene experts. As you know, we discuss this issue. We write reports and we do policy, which Congress and administration frequently seek our advice, and that also many foundations and healthcare providers. So we have had reports. One of our most important reports is called Neurons to Neighborhood, linking the issue of brain development, mental well-being to, in fact, where you live and your early childhood and the importance of environment. We've looked at this issue, Eric, about delivery of care, and like many other experts in the area of healthcare, we've concluded that this has to be integrated in the fabric of day-to-day care. And of course, the place to start off with is in primary care, right? Primary care where people are sensitive, aware, can actually sense and detect early issues and being able to provide with the support before you even have to refer to, if you will, specialists. So one of the most effective ways is to do integrated team-based primary care. That team-based primary care with nurses, social workers, sensitive to this issue and trained in the area of mental health, be able to provide that kind of team-based approach, but actually with emphasis on wrap-around services, social work, case management, medication adherence, and others. Important to think about linking self-care to primary care. In other words, what you have to think is to normalize mental health care as routine in primary care and to integrate it into chronic disease management. So let me talk a little bit about what I'm saying. At the end of the day, people spend the time at home, in their community, at work. So you can't see care as episodic. You come to see me, I'm going to take care of you. So it's really important to integrate community-based organization, workplace, as One Mind is doing, and share activities between the clinic as from the community-based organizations. And of course, there are models in HIV treatment, for example, called the Ryan White model, which even integrates funding, which allows people to share the care of the patients. So that's one. The other thing that's really important to understand, of course, is that when people come to you, it's proposed that really should look at, make sure you understand the social backgrounds, social determinants. Some people call it trauma-informed care. That is, what's their individual, family, community level trauma, how they're vulnerable to the situation, and how you can intervene. Last point I want to make. I want to come back to the community issue. Because in US, we talk a lot about this, but you know, in the rest of the world, where resources are even less, they have to be very innovative. And the innovation here includes examples in India, where there's an organization called Sangath, large NGO, where they utilize community workers and lay people to provide at least support services and, you know, to support them when they're depressed, to be able to manage, you know, even in schizophrenia, as a way to reach out to community before you have to go to a specialist. So if you bear with me, the other thing I do want to talk about is what's in the future. So one is changing the model of care. Second is science and innovation. This to me is the good news. If you look at where we are today with mobile devices, cell phone, iPhones, tablets, you name it, they are now used to monitor progress. And therefore, as I'll talk a little bit more, they're really useful in the future to very early detect and for people to intervene. There's internet-based support groups, and you already heard some of their online services. And of course, there are apps for treatment, including depression, anxiety, and addiction. So when you look at telemedicine, for example, I think COVID has shown it can be used effectively. And as many of you know, there's been 1,000% increase in the use of telehealth. But when you look at how telehealth is being used and data show that it works, you know, when people have mental illness, the ability to connect through telehealth is very effective and important. So particularly in areas when people have difficulty of access, remote areas, is extremely effective. During COVID, already there's a, shall we say, loosening, if you will, of the regulation restriction in the practice of telehealth and the reimbursement, both federal and state. And so I think that we don't want to go backwards. We want to use it a lot more for support of mental health. But also new technology, artificial intelligence. You know, there are places out there where they use data sets to monitor, for example, voice recordings is not what you say, it's how you say it. So when you begin to use the algorithm and understand the normal behavior, any changes, you can begin to look at stress and perhaps early depression. And there are companies out there like Strong Mind, who's working with insurance companies to, in fact, connect with this and even cover the payment for this. So I think that AI, not only in the application of this, but eventually would be able to help people to self-navigate and shall we say, treat. So I think there's a lot of excitement on this area, and I am optimistic, Eric.
Fantastic, Victor, thank you. Brandon, go ahead.
Yeah, Victor, thanks for sharing your wisdom and knowledge with us today. We have questions pouring in from the audience. You're a popular guy, and people want to hear more about
right.
insights. I'd like to answer one of these questions right now, if you don't mind. Let's see, where is it? Here it is. Question from Colleen Buckley in the audience. Can you address the problem of mental health care providers, especially those in rural areas, getting paid for their work? This is a huge obstacle for our beloved private providers.
Well, I think Colleen's
and you know, Victor, before you get started, let me just broaden that question a bit, because there's another audience question, not only highlighting rural areas, but at the opposite end of the spectrum, inner city areas where the challenges are also great but different. So how can we get around zip code determining the level and quality of care?
Well, if you in the zip code area, obviously we're talking about the particular issues of social determinants, which is so important. Understand the environment they live in. That's why I keep on emphasizing that it shouldn't be seen as episodic care. We have to really get into the environment, the community. On Colleen's question, this is the big challenge, isn't it? I think we do have to really change reimbursement system, payment system. My own feeling is we're moving in the right direction in the nation, particularly as we think about more integrated care. And certainly there's a lot more emphasis on integrated care, the accountable care organization, et cetera. The more you're interested in the outcomes, the more you're likely to spend money on prevention and early intervention, the more likely, therefore, be successful. So to the extent not only about payers changing things, but in those accountable care, you manage your own dollars. And if you're able to distribute and say, who am I going to pay first, second, I would definitely pay a lot more to frontline workers. But we do need a lot of policy change.
Absolutely. That's very true. And One Mind is working with other mental health organizations to advocate for policy change at the federal level. Another question from the audience, and thank you so much, Victor, for that.
Sure.
And another question from the audience. Anonymous attendee asked this question. How can psychiatry either collaborate with and or learn from other medical disciplines like cardiology, pulmonology, oncology, et cetera, to better understand the causes of mental illness and better personalized treatment?
Yeah, I think this is where research is so important. And, to get down, I'm a cardiologist. If I look at last 50 years, there's 50% reduction in mortality. It's not just the drugs, it's not just the vices. It's actually going to understand what are the predictors, what are the reasons. Framingham study, look at the risk factors, cholesterol, you name it, and begin to bring in the idea of attacking those fundamental factors led to it. I think a lot more research is needed. I think research both in the basic science, but also in translation, connecting social sciences to biologic sciences and medical sciences, and bringing together all different sciences to look at how to make a difference, what we call convergence, if you will. And then the implementation piece. We don't do enough implementation science, which is now that how do you improve the models of care we just talked about, and what's the evidence of how to approach this?
That's very true, and that's why One Mind is doing implementation science support through our Aspire program. So thanks for highlighting that. Another question, we have a couple of questions about relating to peer support. Let me just read this one question from Obi Felton in the audience, and then that dovetails with that from another audience attendee. A few questions related to access, Obi asks. How can we grow the pool of mental health providers faster? For example, training more therapists like IAPT in the UK. But given the evidence for integrated care being highly effective, why is it not implemented more? And then the third part of the question is, what do you think about peer counselors like the Friendship Bench? Would that be a lot faster to deploy than brain health licensed therapists?
Oh, absolutely. I think for the last one, I'm not an expert in this, but I can tell you is what I said earlier. If you look at what's going on in India, these people really are peer counselors, but people who are actually there connected and being available to everyone. I think that's so much more important than having the super specialists. Of course, we need them, right? So I think how to move things faster has to be, number one, changing our education paradigm. But by that, I don't mean, make sure that doctors understand this, but I think all health workers, community workers, at least need to know the fundamentals of mental health and well-being. But secondly is changing the whole payment system. There's no question in our country, what's happening is the payment warps the incentives, and consequently there are more specialists and much fewer people in the community and primary care, integrated care. So I support accountable care, the ACA, what we call Obamacare, because we're moving towards alternate payment models where more and more you're looking at outcomes and looking at, in fact, early care in terms of ambulatory and less specialty care.
Thanks, Victor. That's wonderful to hear. Eric, you had a question for Victor, I believe?
Yes, we only have a few minutes left, Victor, but I was hoping you could end by telling us about HBGI.
Yeah.
You talked about the need to leapfrog for a dramatic change in the way we address mental health globally. Please tell us about HBGI.
Well, so I think the issue here, as I said, is do we have enough attention? Do we have enough investment? And we need to leapfrog the way we do things. So I've been very fortunate to be connected to Garen Staglin. He's the one who recruited me to say, we have this bold idea, you want to help. And when I listened to this bold idea, I said, of course, it's the best idea I've ever heard in this field. The idea of creating enough resources globally to address the issue of mental health through research and implementation. $10 billion, a financing mechanism. That's a lot of money. I think we need even more. But $10 billion in the area of using a different financing mechanism so that there's sufficient resources to spend over 10 years to change the way we do things. So quickly, what are they? One, of course, we recognize, as been said by Brent and others, that research has to be looking at outcomes and how to implement. We do know that a lot of ways which we know how to implement but they're not, in fact, done in low middle income countries. So implementation science is really important, can change the burden. Translation and discovery science. When you look at the research which is being done, and there's tremendous research, good basic research, we need to bring it to patient research. That is being able to look at what's happening in their brains, what's happening in the population, and how can we actually look at understanding population around the world, having new cohorts for studying, and the material to study. So this mechanism is bold. The idea is to raise 10 billion using a number of different mechanisms, such as philanthropy, really important, such as impact investment, such as creating a bond, where people can invest over time. The California CERM or stem cell bond, 3 billion, is a good example. And over time, the return investment is over $11 billion in California alone in economy, but also improving health and management, and going to sovereign funds and going to corporations. So that's what we're working on. We got some of the best minds in research looking at what needs to be done to leapfrog research, best mind looking at measuring the success, best mind in looking at how to raise the money, and importantly, how to create an independent organization that's multinational and as a group like the Global Fund to make this happen. I'm truly excited about this. I think this is a bold initiative that can truly change the field.
Excellent. That sounds like such an exciting initiative. We have several other audience questions, but in the interest of time, we're going to move on to other speakers, but we'll return to you, Victor, at the end of the session when we have a more general question period from the audience.